Hi, my name is Grace Steinhauser. It is currently June 27th, 2021 is my name and the date. This is my piece of paper. It's my note card. It's only on the back. It's only on the front. I'm sorry. I will be referencing my piece of paper, but I will not be reading from it. Today, I will be talking about Parkinson's disease. Parkinson's disease involves the nerve cells or neurons that control movement in the body. They become impaired or they die. Uh, Clinically, a lot of patients present with Parkinson's disease, and the biggest tail sign to tell that the patient has Parkinson's disease is having a tremor. Tremors include tremors of the hands, of the head, of the jaw, legs, or arms. The most common tremors are ones of the hand, so if a patient is constantly trembling their hand or their head, if they kind of like have a twitch, but it's a constant tremor, if they're just doing this, those are tail signs that a patient has Parkinson's disease. A lot of other times patients will have impaired balance or coordination. With Parkinson's disease, they have difficulty transitioning from sitting to standing or walking from room to room. They just don't have that balance to either move quickly or just to move without assistance. A lot of times patients also will have stiffness in their arms and legs and trunk. And they have slow movements with this because they're so stiff, and they also don't have the coordination to move very fast with Parkinson's disease because their mind is there, but their body just isn't keeping up with them because there is that impaired neurons in the body that is kind of disconnecting. A lot of other syndromes are similar to Parkinson's disease. They present in a similar fashion, but also it's only a part of the symptoms that someone with Parkinson's would have. The first one being Cerebellar Syndrome. This involves gait, balance, and coordination, just like I said about Parkinson's disease, but that's the only thing that it really affects. It doesn't affect the limbs or a head tremor or anything like that. But cerebellar syndrome is likely due to a stroke. This can be an inherited stroke, or it can be an infectious stroke, or something like that. So a lot of patients with cerebellar syndrome have difficulty with balance and coordination. And so that's very different than Parkinson's disease, but can present similarly. There's also Meningeal Syndrome. This will only affect the neck and the head. It affects it's an irritation or inflammation of the meninges, which is the 3 layers of protection protecting the brain and the spinal cord. Like I said, it affects the neck and the head, so this is stiffness, headaches, and fevers that affect the head and the neck. It doesn't affect the limbs or anything like that. So that's also similar because there's some stiffness, but it also is only presenting in the neck and the head, so that's a tail sign that it is not Parkinson's disease. The third one is a nervous system syndrome, which is Comatose Syndrome. A lot of people know people who have slipped into a coma, or from TV shows, a lot of patients slip into comas. And this is a prolonged state of unconsciousness. So a patient is unconscious due to either a trauma, a head injury, a stroke, a brain tumor. Can also be due to alcohol or drug intoxication, like excess, way too much alcohol or drugs, as well as other underlying issues or illnesses/diseases. Comatose is clearly very different than Parkinson's disease because someone with Parkinson's disease is very conscious and they are able to walk and talk and that kind of thing, whereas someone with comatose syndrome is unconscious. They are likely laying in a hospital bed, having a machine breathe for them. So it is very different than Parkinson's disease. With Parkinson's disease, you can get many unfortunate diseases such as depression or other emotional changes, and this is very frustrating for the patients as well as caretakers because someone with Parkinson's disease, they have a disconnect between their brain and their body. Their body isn't doing what they want them to do, and it's frustrating because they have the mind and they have the knowledge to do things, but they can't because their body won't let them, and that's very frustrating. And it's hard to see someone go through that. With Parkinson's disease, you can also get many urinary tract infections. It just comes with the illness. And then as far as skin problems, you can get very dry. And then there's also sleep disruptions with Parkinson's that you can get. So you can get sleep apnea or something like that. But there's also someone who can get sleep issues because you have a tremor, or there's other just underlying issues that are going on with the body that are predisposing you to getting sleep diseases. Overall, Parkinson's disease is a very frustrating disease. It's frustrating to have someone go through it. It's also frustrating for the patients as well because, like I said, it's hard to have your body not do what you want it to do, whereas your mind is fully clear and fully there. It's just frustrating because your body is kind of just letting you down. So yes, that is Parkinson's disease. Thank you for listening.